part 2, yeah, because now it gets more excited.
Okay.
My questions are a bit more
Intense.
more not really intense. I think it's more.
You need more drink?
No, thanks.
I think the question that I have is also partly what I've experienced in terms of my stories, and so my dog, who is a Belgian Shepherd Malinois, by the time she reached about 9 years old, she started to sneeze quite a lot. And at that point, I thought, oh, because it's the weather, hot and cold, and she lives outside. So I didn't really think too much about it. She started to sneeze harder and harder till I started seeing strains of blood in her mucus. Then this was like my trigger point. I was like, oh no, shit, maybe she has brain tumor or something. I don't know, right? So I got a little paranoid. And I brought her to a vet. Of course, I'm not going to name any vet, but otherwise I won't go back anymore. But yeah, so I took her to the vet, and they prescribed her with antihistamine and medication, just because we didn't know what it was. So after about a week of that medication, I started seeing no improvements at all, zero improvements, and so I was like, okay, maybe this medicine is not good enough, not strong enough, whatever. Brought her to another vet. Same thing. Gave me this different but stronger medication, and it prolonged another 1-2 weeks. But I started seeing very, very erratic changes in her behavior, and her nose started sneezing stronger and stronger, to a point that whenever she sneezed, there would be blood everywhere, right? So this is when I was like, oh crap, what is this? Could this be? Or is it? I don't know. So then I brought her to another vet. So bear in mind, I already had visited multiple vets already. And by that time, I've explained that situation. And they told me, why don't you just go check out this hospital, bring her there, and see what they can do. So there's a couple part question here, right? I brought her in. They did a scope. They checked her nose, went in, and they wanted to do a biopsy and try to take out what was inside that they could see. They pulled it out, whatever they saw, and they told me that we had to send it to Australia. Now, this is one question I have. Is the technology advancement in Malaysia for veterinary services, is it to standard, to your standard, or do you think we could improve a lot more, right? This was the first question. Then down the road, we found out it was nothing. It was negative. And 2 to 3 days after that scope, she started to sneeze again, and this time it was like a murder scene, like to a point my whole car garage was full of blood. And this made us panic because we didn't know what happened. We didn't know what was going on. She just kept bleeding through her nose, just bleeding. Then I tried to stop it, and the only way I could think of stopping it was really hold her up and really put towel all over her nose and just apply pressure. And whatever I could think of, I tried to do. And we managed to stop it. Then a day after that, in the morning, my maid managed to pull out a leech coming out from her nose, hanging out from her nose, and we were like, oh my god. So this is what was causing this. This was about 6 to 7 months in already, which we couldn't find after the scope even. Then, after taking that out, she was clear for about a week or two. She started to bleed again. At this point, I went back to the hospital. I said, hey, I think I know what's the reason now. And I've mentioned to her, I've WhatsApped her, told her, hey, the first time, the reason why she was bleeding was because maybe it was the leech that caused it. How the leech came in there, I don't know. Because she doesn't go out. We don't go hiking, we don't go to all these kind of things. It's really unexplainable. But the vet at the hospital actually kindly suggested we do another scope just to check. I agreed to it because I wanted to know what it was. So at that point, she managed to shove the camera up to her nose and see what there was another leech inside, which then the moment the light shined inside, the leech went further in. And this was when she started to use saline solution, salt solution, whatever to try and flush it out. But it couldn't come out. So this prolonged, and I think throughout that time, from the time she started the sneeze till about that point was about 9 months already. And I started to see facial changes. You know, she started growing growth on her left side, on her eye, covering the eye already. And you know the flower horn fishes? You know, they just grow on top of the forehead. It started to grow there. And finally, it started to grow on the right side as well. So this is something that, for me, I believe, obviously I don't know what it was. And I went to at least 6 to 7 different vets. And I believe no one could actually find out what it was. But my question would be, you know, what do you think of the veterinarian technology today in Malaysia? Is it advancing, or how could it be improved? And would you guys appreciate, like, if I was to donate my dog's body to the vet, would you guys be happy to study it, like that kind of things? Because I think it's important for today's society to really understand how we looked after our dogs, what medications that we can actually give to improve the community as well, so we can prevent these kind of things from happening in the future. Yeah. So the question was basically yeah, a bit long, but the question is basically more on the advancement and technology. Yeah.
Okay. To answer your part, Brandon.
Yeah.
First thing first is, there are certain clinics or hospitals, whichever it may be, that tend to believe that outside Malaysia they do a better job than within Malaysia. And it costs you a bomb.
Yes, I agree.
It's not cheap.
100%.
It's not cheap.
Yeah.
Currently, I would say there are a couple of labs in Malaysia that do an excellent job, because the pathologist as far as they are human pathologists, they are also able to read very well veterinary pathology. That is one. The second thing is, with regards to the faculty, they also have a pathologist, and she's also reasonably good. I have not used her, I do not know, but I've been told that she is good. So with regards to facilities, yes, I think we should stop trying to see that, you know, sometimes it is believed that if I get an Australian report, the value of it is much more than even if it's a similar report from a local, which is not fair.
Yeah.
You know, because at the end of the day, it's a cost that is involved to the client.
Yes.
First. Second thing, with regards to that particular incident of your dog, if you're looking at the current scenario, I think you would be able to identify, because of the presence of certain clinics have got your MRI.
Yeah. Yeah.
So an MRI would do the best. When you do an MRI, you're getting a cross section, you'll be able to see clearly. With regards to a scope, yes, because the entire sinuses are interrelated or interconnected. You go in with a light source, you can flush as much as you want. That thing is going to move, keep moving. You know.
And
so
it's a maze in there for them to
yes,
Yeah.
because once it goes into your frontal sinuses, there's a lot of excess roots within that area for it to actually move. I had a case of a cat, a Persian cat, which was actually drilled up here because of a sinus problem. Someone did that. They drilled to actually remove the discharge.
Wait. Yeah, so
The
these are
poor
the...
cat is suffering until now. The hole here.
You know, because they said they wanted to drain the sinuses.
Wait.
the frontal.
So wait,
Wait,
just
no, like
for
the
the-
owner?
No.
Oh, okay.
It was done by a
Okay.
professional. So
For the ones listening, the hole is in the middle of the cat's forehead, above
Yes,
the
yeah.
eyes.
So it was used to drain the sinuses.
Okay.
Okay, so once you do that, that particular passageway or access is not, you're unable to
It's
close.
open.
It's
Yeah.
open. So
Yeah.
that particular pet had excessive amount of nasal discharge every time. You try to clean the sinuses, everything comes out. The sinuses get infected, everything comes out. So what I'm trying to say is the anatomical structure of the facial area is very, very
Agreed.
sensitive, and there's a lot of passageways because of your
Yeah,
sinuses.
yeah.
If they had seen that particular what do you call this, leech, your best option is go surgical.
Yes.
Don't
Right.
bother to go to try to get the guy to come out by a scope,
Yeah.
until and unless you have actually held him in place. But bear in mind, he is a leash. He can split, he can hold, he can hang on. Even a leech that bit her the last time we went to KKB, it took her 48 hours for the bleeding to stop.
No way.
Here, I try.
48 hours for the bleeding to stop because of the anticoagulant that they inject into your system.
To keep it from, you say, doesn't clot.
Exactly. So it keeps on sucking. So in that particular respect, I would say the right thing to do is, once you have identified, go in surgically, make an incision, search for it, take it out, close everything up. That would be the right thing to do.
Yeah, so I was advised of that actually, but the reason also was because they weren't sure.
Exactly.
Right? So for me, it would be a 50-50. I mean, for her losing an eye is no problem as long as she's cured. That was my thing. But I mean, by that time, by 9 to 11 months roughly, she managed to survive. The last straw was seizure. That was like So I was away, and when I was on the way back from the airport, my wife was calling me and saying, "Hey, Kira is having a seizure." I was like, "Are you sure? Do you know what this dog seizure would look like?" So by the time I reached home, I saw Kira. She was okay. She looked normal, very, very, very fine. Then after 5-10 minutes being at home, I started seeing her groggy. Then I started, something is coming. Moment she dropped, boom, then you can see her going crazy for at least 2 minutes. And this was for me, wow, it was very, very difficult for me to see and not knowing what to do. But of course, in what I know, you can't really do much to help a seizure patient or whatnot. But the least I could do is just put pressure on her eyes, right? And this happened 2 to 3 times. So it was a Sunday, right? And worst time, no vets were open, right? And I had to fly the next day as well. I had to fly out for work. Then obviously my wife could not look after her, so we called emergency and tried to check her in to see what we could do. And by Tuesday, for me, this is again, I think we're moving forward. I think I have a question for Anne, right? Yeah, a question for Anne. Because for me, my last straw is that if my dog doesn't eat, that is probably I can't do much. If my dog can pee, poo, all these things, I can still help because I can physically carry him, help her or whatever, and soothe her. But I cannot force feed my dog and stuff. So that was my last straw. So she checked in on Sunday night. By Tuesday, I got a call from the vet saying, "Hey, she's not eating." That was the time I had to make a decision. And I would really, on a normal circumstance, I would not make that decision to put her down. But because you could see her suffer, and her facial changes was so bad that I just felt like, okay, it's enough. So here's my question, Anne. So I'm sure you've dealt with a lot of patients, their owners. How would you handle their distress in a circumstance like that they have to put the dog to sleep or whatnot? How would you usually care for them in that aspect?
Before the vet decide and to put down the dog or the cats, I will suggest we try first. If the animal is not eating or not able to drink water, liquid, I will try my best, like liquid nutrition, the food. I rinse it, sit with her or sit with him. If she is still a puppy, I carry him like the way I carry Kobe.
Yep.
We have Kobe in the clinic that we got problem. And then after that, we give the owner the 48 hours or 72 hours, that period. If the animal won't show the
Signs of
signs of
improvement,
improvement, and so we will see that it's time to let him go. But if we can do something, we will try, because it's life.
Yeah, I agree.
And especially
Yeah.
if the dog or cat is been with you, it's a family. We
I'm
cannot
sure it
just
must be super tough for you guys to handle this.
Yes,
Yeah. It's
I really
really,
always
really hard. Yeah.
always cry
Yeah. That's so
and
difficult.
talk to them.
I think I popped by the vet once and I saw Anne in tears, and I can't remember, there was a few times. Yeah, and doctor just said to me, we had a rough day.
We try. We need to try our best.
Yeah.
If we can help,
So yeah, thank you so much. We're going to end this podcast for now, but really thank you so much for coming and sharing your experiences and knowledge with us. And just to end it, I just want to know, like, if you have any tips for anyone who is aspiring to become a vet, and I think it would be grateful for them to listen from a professional like you, Dr. Clement.
Don't break bond.
Yeah.
Huh?
Don't break the bond with the government.
Save 80,000.
The main thing is, before we go to this,
Yeah.
I would like to make it very clear to all. We have the facilities in our country to treat most of our patients. As much as the outside looks, or the other countries like Australia, New Zealand, even Thailand is way ahead of us.
Yes.
Thailand is way ahead of us. But we do have the facilities. It's just a matter of whether we look at these facilities and tell ourselves, look, this is good enough and we can use them, or we feel that it is, no, we want to use someone that is outside. One. Second thing is, there are a lot of us here who have indirectly identified their area of interest. So try to find these people who have got their area of interest and use them to the maximum, because they know what they are talking of. They are well aware of what they are talking of. The faculty by itself is well equipped, but with the present problem that we have within the government itself, funds are limited. So you have these problems as far as, sometimes most of my cancer cases, I refer them to the faculty, because there is a good person there who is good with cancer, oncology. So the facilities are available, but it's a matter of knowing where they are.
Right.
And who are the ones that are involved in this, that part of it. With regards to veterinary medicine, I think the most important thing in veterinary medicine, especially, you see, veterinary medicine, a lot of us believe or feel that veterinary medicine is companion animal medicine. It's not companion animal medicine. Veterinary medicine is livestock medicine. That is how veterinary medicine came into play. No one started veterinary medicine because of a dog or a cat.
Yes.
Never thought of it.
Veterinary medicine has always been livestock medicine. It was only through the years, it was either equine, large animals, wildlife, livestock, because that was where the bulk of the interest, the need was. Food, a food chain. You wanted that food chain. So that was where veterinary medicine came into play. That is why in most courses that we take in veterinary medicine, livestock still plays a very major role, except in certain countries. Like, for example, if you look at countries like, for example, Taiwan, Korea, you have a very good blend, or even the UK, most of these other countries, you have a very good blend of syllabus between livestock and companion animal. companion animal came into practice, give and take, you're looking at approximately about 100 years ago, or even might be even less than that. I'm not very certain. But the building up of the livestock or companion animal practice in Malaysia is very much more on the interest of individual veterinarians who decided to actually build companion animal practice. It was never a primary concern of the department to build companion animal
There's
practice.
no mandate anyway.
Infirmaries were there, but infirmaries were looking after livestock, they were looking also after companion animals. But if you're looking at private companion animal practice, or even the part played by privateers in companion animal practice, is a lot more than what the state does or what the federal government does. There's no infirmary currently in the federal government to actually look after your cat or dog. You can go there, but whether the vet sees him or whether it is an attendant that sees him are completely two different things. So companion animal practice is something that is very, very recent. So if you want to look at veterinary medicine per se, you will basically have to identify your area of interest. If you're looking at companion animal, you must love animals. If you're looking at livestock, you must love livestock. It's not just because it's a meat chain that you can go in and say, look, the fella is like that, so chop him and slaughter him. It's still alive. So every profession, whichever the profession, whether it's a doctor, dentist, you must love your profession. If you don't love your profession, it's very difficult. You feel very unhappy.
Yeah.
You don't want to work those long hours, because sometimes in companion animal practice, like in human medicine, you go into a clinic, for example, you go to a clinic, he sees, look, I can't sew that because it is bleeding profusely.
Go elsewhere.
Go to GH or go to KPJ. Whereas a veterinarian cannot do that.
Yeah.
A veterinarian does from A to Z. He does a cesarean section, he does everything, he does bones, he does dental. Your tooth is, you don't go and see a GP. You go and see a dentist.
Yeah.
So you need to have that compassion. If you don't have that compassion, it's very difficult. And you must, especially if you go into companion animal practice in the private sector, you must understand that time at times is no more your priority. Your priority might mean your patient, because your patient is dependent on you. Leave the owner aside. The owner is a completely different ball game. He pays the bill, he screams at you, or whatever said and done, But your priority is to that pet that is unable to express itself to you other than its facial expression. So in that particular context, sometimes time is no more your priority. You might have to stay back, it's not something that I can say, look, I hand it over to you. Yeah, if you have another vet with you, you have a night vet, you can say, look, take over the case. But whatever said and done, you still need that particular compassion for you to actually be in practice, in whichever profession by itself. But always remember, veterinary practice was nothing to do with companion animal.
Yeah.
It is always livestock.
Here's a question on your dental, because also I might bring my dog over. So, do you have to put them on GA or anything?
Oh yes,
Or
there's
must?
no way you can do it without GA.
Okay.
I've tried it with Duke. I've tried
Your
it.
own dog as well, yeah.
I've tried it with Bruno. The main reason is because what we are using is similar to the human scaling.
Yeah.
The jet of water triggers a swallowing reflex.
Right.
Swallowing.
Yeah, because when you're scaling, water is coming out from that machine. So what happens is the dog wants to swallow.
Right.
So the tongue is everywhere.
So the tongue is moving all over. Can you imagine a Rottweiler's tongue moving left and right? You can't do
Does not
anything. So what you need to do is sedate the animal, and at the same time you also need to use an endotracheal tube to make sure water does not go into the lungs, and then go ahead and do the scaling. So the same thing like how your dentist put for you a suction, but
Yeah.
you psychologically do not swallow because
Yeah,
You know what's going on.
Exactly.
Yeah.
But the dog does not know that.
Yeah.
You know, he must be wondering what is this water coming
This
into
water
my
fountain is non-stop.
So is there a discount?
Don't worry. He always takes care of us.
Okay, so thank you so much again. Really, thank you
no
so much.
problem.
Yeah.
You're most
Honestly,
welcome.
I learned a
A lot.
lot.
Yeah,
I
same.
learned a
I
lot
really
in this
did.
session, and it has been an absolute joy listening to the both of you. Thank you for your time. Thank
No
you
problem.
we are very sure we're going to call you back again for
Yeah.
another topic.
Yeah, this time we'll prepare some drinks.
Yeah, this time I will make sure the drinks are proper. All right. So Brandon, where can we find you?
You can find me on Instagram at Baros Wonder Tigerland, BarosVonderTigerland, Baros Wonder Tigerland.
And Leanne, where can our listeners find you?
The Doberbae, TheDoberbae.
My name is James, and if you are interested to follow us, you can find me on Bullies and Rotties. But we also have an Instagram account now.
And we also have a YouTube, so make sure you guys subscribe.
Yeah. Hit the like button,
Comment.
follow us, comment. And thank you so much.
Wait, it's What's Up Dog. You got
Oh, What's Up Dog? Sorry, What's Up Dog?
Yeah.
You spelled
And then-
you
and
spelled
then,
the whole thing out?
Our Instagram account as well. What's Up Dog _podcast.
And Dr. Clement and Anne, thank you so much. So
Thank you.
if you're around the area, if you're around KL Taman Tun area, I personally, it's not an advertisement, but I personally highly recommend Dr. Clement and Anne. I've never been anywhere else. They take care of my Rottweilers, and it has been so, and it will be so. So you can look them up on Facebook, Taman Tun Dr. Ismail, Veterinary Services Clinic, Sindram Berhad. This has been a great third episode, and we hope you enjoyed it as much as we did. We'll catch you
We
around.
have a few more listeners. We don't
Yeah.
even know how many listeners are listening.
It's gonna build up.
So far, it's just 3. Yeah.
All right.